Good evening, everybody. How's everybody doing? If anybody has a specific BFR question while we're kind of waiting, you can unmute yourself and just ask me, and I'm happy to answer. The other thing you can do is go in and send a message. I'd like to test the messaging. So if you could just text where you're from in the message, we'll just test that, make sure that way I can answer questions. I don't know what, Greenwich, beautiful. Prosper, Texas, what's up? Roger, not too far from you. And just so everybody knows, I'm in Dallas. Just curious, how many people are currently using BFR? Either in their own fitness, rehab. Bob, awesome. Just got the SmartCuff, nice, Lando. Tanya, nice. All right, who's never used BFR and they're coming in just going, I'm not sure what this thing is all about, so I'm gonna just check it out. LWGA, nice. A little bit of prehab before your total knee, very good. So tonight we're going to talk about why BFR is such a good option for sarcopenia. And it falls right in line with kind of the philosophy of using safe rehabilitation or safe training in order to build muscle mass and strength. If you don't know me, I'm Ed LaCara. I own a private clinic in Texas called Body Lounge Park Cities. We are a functional medicine, medical aesthetics clinic. Been the director of education for Smart Tools since. Prior to that, I was the director of education for Rock Tape. I've done a bunch of work with TRX, all kinds of companies. Wrote a couple chapters in the NASM, corrective exercise specialist program. I've been in private practice for about 26 years. Undergrad is in science. And so I've been a big believer that my rehab should match strength and conditioning philosophy, but just at a lighter intensity or a lighter load so we don't cause damage to the injured tissue. Believe it or not, this is not a normal kind of thinking among rehab professionals. So it's a little different, but I'm coming from the strength and conditioning lens when I'm doing my rehab. And so that's why BFR was so intriguing to me when I discovered it back in 2015-ish, because throughout my whole career, at that point, it had been 15 years, I knew I didn't have enough time to truly rehab somebody in the clinic. And what I mean by that is that true muscle hypertrophy and true strength typically takes somewhere between 12 and 16 weeks to accomplish. And I didn't have 12 or 16 weeks with patients. Either their insurance would run out, people would get out of pain and then drop out. They would just get tired of coming in and leave. But the biggest thing with my practice was people would get out of pain and then they just be like, I'm going to go back to my normal activities. And so I never got a chance to really bring their tissue back better than what it was injured in, if that makes sense. And then I discovered BFR. And with BFR, we see changes in strength as early as 3 weeks. We see changes in muscle mass as early as 3 or 4 weeks. That's not just neurological. These are true changes. That's why I was so intrigued about it. Plus, you're only using between 20 and 30% of your 1 rep max, whereas normally you need to use very heavy loads. And heavy loads are typically not going to be tolerated by people that are injured. And so how this ties so nicely into sarcopenia discussion is that I use BFR with older individuals because they typically cannot tolerate heavy load training. And so we're able to use still light loads that's very safe, but when we add BFR, we can get the results of heavy load training. So that's kind of what brings us to this topic and BFR overall, and why BFR is so popular now. So what we'll learn today is what is sarcopenia, why it matters, why traditional strength training often fails older adults, what BFR training is, and why BFR is a safe and effective option for our sarcopenia, and then in advanced sessions. So what is the definition of sarcopenia? It's age-related loss of muscle mass and strength and functional capacity. It starts as early as the 30s, third decade of life, accelerates significantly after age of 60, often goes undiagnosed and undertreated. And what's kind of interesting right now, what I'm seeing in the marketplace is that people are starting to become aware of this much earlier, and it kind of freaks people out. And so people before would think like, oh, I don't need to lift weights. I think pretty much everybody knows they need to lift weights. Like it's hard to meet somebody that doesn't go, you know what, I don't need to lift weights. Everybody knows they need to lift weights. It's just a matter of, will they do it? Are they scared of hurting themselves? They don't know what they're doing and they don't know how to program, and so they just don't do it. Or they're intimidated to go to the gym And so they don't want to go in the gym. And so there's a lot of barriers to safe and effective strength and conditioning. And so one of the, kind of goals of Smart Tools is to be able to bring this to the masses so they can just do it at home and get the education and the tools they need in order to improve their lifespan and overall enjoyment of life. So why sarcopenia matters? It's linked to increased risk for falls and fractures. And we all know that your risk for death, if you fall and fracture, let's say break a hip, exponentially increases. Sarcopenia is linked to difficulty in daily activities, difficulty lifting things overhead. I sit on an airplane and I sit there in the aisle and watch people struggle with their bags. These are just carry-on bags and they can't get it overhead into the overhead bin. And it's not because they're too short. They don't have the upper body strength to be able to do it. And so you think about, as we get older, the inability to squat, to get on and off the toilet, to get in and out of a chair. The more that we stop moving, the less we can move. And so we really want to promote this ability to be independent, to be able to be strong throughout our lifespan and be able to do those things that we want to do. So we can enjoy our life. The problem with traditional strength training is that many older adults cannot tolerate the heavy loads. They might have joint pain or arthritis, post-surgical, or they're deconditioned. It's in this generation, maybe never even was exposed to weight training. And so then we're asking people to start, doing it later in life. They might have fear of injury or movement, struggle with adherence. And so what the result is, they get underloaded, they get poor results, and they continue to lose muscle. And then it doesn't help that our hormones are changing, declining over time, testosterone reduction, estrogen reduction. You're getting inability to metabolize protein. As we get older, we don't want to eat as much. And so we don't get the caloric intake that we need. A lot of times our food choices become less and less. Our taste buds are not as acute. And so we don't eat as much because we just don't enjoy the food as much. And so this all kind of leads to this loss of muscle or this sarcopenic transition. So kind of feel like there's this gap in care. There's this gap with what works physiologically and then what older adults can actually do safely. It's hard for me to tell somebody that doesn't have experience with weightlifting, like, hey, I know you've never weightlifted before, but why don't you just go in the gym and, lift 65% of your 1 rep max? Kind of a big ask. And it's difficult to do. So my parents, dad's 81, mom's 83. My mom is, she's a nurse. She's been a nurse for over 60 years. She practices with me. She actually acts as my nurse and MA in my office. They lift weights every day. I mean, pretty much every day they go into the gym. And I should have a picture up really of them. I should show this picture. But it's amazing what happens at that age when you exercise almost daily. You don't drink too much, you don't smoke, you try to limit your food intake, you get good sleep, how well they function both physically and cognitively. And I know that they would say that weightlifting is a big component of that because they can pretty much do the things that they want to do. They just got back from a 3-week trip in Europe and, 91, my dad's going around 20,000 steps per day. Of course, they monitor it. They've got Whoop bands. And so it's very inspirational for me. It's only, I'm getting up there. So it's only like 30 or 40 years away. And so, the time is kind of always now, and we can always improve our physiology. And that's the amazing thing about the body is that we can always improve. I've seen studies with 85-year-old women just doing resistance training to failure with TheraBands and still increasing strength and size. The body will always adapt if we stress it appropriately. All right, so what is BFR? So blood flow restriction training, if you're not familiar, is it's a technique we use. It's been around since about the 70s in Japan. And you use a specialized cuff and you place it around the limb. It kind of looks like this, although I don't like this picture because the cuff is too low. That cuff should be up a little bit higher. And you can put it on the upper leg or the upper arm and you inflate it to a certain percentage, basically millimeters of mercury, almost like inflating a blood pressure cuff. And then you lift weights with it. And you are lifting very light loads, 20% to 30% of your 1 rep max, which is not very much. It's pretty light. This creates a strong muscle building stimulus, both mechanical tension, but more so a metabolic stress. And that metabolic stress kind of stimulates the body into increasing muscle size and muscle strength very early on. As early as 3 weeks, we start to see changes. Whereas what I mentioned before, up to 12 weeks is what it might take to start to get true physiological adaptation. And all this without putting extra stress on your joints. That's a little better. I'd like it a little higher still. You really want that cuff right underneath the deltoid tubercle, so a little bit higher up on the arm. So how BFR works, super simple explanation. It limits blood flow into the arm, doesn't fully restrict, but it limits. And so there's not as much blood going into the arm, but it totally occludes venous return. So what's happening is I put this cuff on my arm, blood typically is rushing through, but we put I'm going to call it a tourniquet. It is a medical tourniquet, occlusion, but we're getting very little blood flow in and zero blood flow out. So venous return is trapped. What that does is that when you're lifting weights, you create metabolic stress. And metabolic stress is really the response to exercise. So you get things like lactate production, different ions and things respond, and it becomes very acidic. And that's the burn that you feel when you exercise. If you take like an exercise to failure or close to failure, you'll feel that burn in the muscle. Well, this accelerates that. It makes this happen much quicker because you're at a much lighter weight, but there's not as much blood flow in there, so you're reducing the amount of oxygen. And then this triggers anabolic signaling. That's a fancy term for triggering things like muscle protein synthesis through the mTOR-C1 cascade. So I don't need to get deep in the weeds, but there's different processes. And we don't know exactly all the different processes, but we know that we get an increase in testosterone and growth hormone production, insulin growth factor. Things like this stimulate using BFR. And so it helps to promote this strength and hypertrophy response. Muscles basically think they are working much harder than they actually are. And so what that does is it keeps the stress down. So if that tissue is injured or your joints are injured, you basically can exercise with light load, but get the response of a heavy load exercise. I'm going to stop there just for a sec and see if there's any questions. Okay, so Karen asks, how can BFR be used effectively for people with varicose veins or other venous problems? So that's a great question. With varicosities, what we are doing is we are blocking venous return. And so it will load the venous tissue a little bit more. And with the varicosities, we have a vein problem that is really a valve problem. So, we have these valves and blood pushes up, and then the valve is like a one-way valve. And so the blood can't backflow. So with varicosities, what happens is there's damage to this valve. And so blood can come up, but then it can kind of fall back down. And so then it pools and it stretches those vessels. We get what you see in the back of the leg typically, which is these varicosities. So varicose veins are a relative contraindication, not an absolute. It's usually a sign of peripheral vascular disease or PVD. So it needs to be watched. We need to make sure that BFR is not increasing or overstressing those valves. So what I typically recommend is taking a picture before you start BFR. Use lighter loads and lighter pressures for a week or two, and then retake some pictures and do some measurements and make sure that that's not increasing. I myself have some varicosities. I was genetically born with some peripheral vascular disease, mostly in my left leg. I still use BFR. It doesn't increase the size of my vascularities, but it needs to be watched and monitored because that is a sign of some vascular problems. Hopefully that answers your question, Karen. So relative contraindication, not an absolute, should be watched. We recommend taking pictures before you start and then taking pictures about every 2 weeks using lighter pressures than you would. You're welcome. All right, I'll get back to it. All right, so BFR is ideal for sarcopenia because it allows for low mechanical stress. You're not overstressing tissue, not overstressing the joint. You get high metabolic and high muscular stimulus. And what I mean by that is when we lift light loads, we typically are only tapping into your type 1 muscle fiber. The type 1 muscle fibers are like our posture muscles. They're the muscles that are used mostly in the presence of oxygen. they are kind of more of our endurance type muscles. Those muscles don't really get bigger. They do, but it's very tough to do. What we want to do is tap into type 2 muscle fibers. So by the acidic environment that I mentioned before, because it gets acidic, it basically fatigues the type 1 fibers earlier than they should, and allows you to tap into type 2 fibers earlier than you normally would. And then you fatigue the type 2 fibers. And then my brain says, and my body says, really, I got fatigued. I might have to do that again. So I'm going to improve and adapt so I can do it again next time better. And that's really what it's all about. You don't have to break down muscle tissue to get adaptation. And I think that's one of the key findings with BFR. When I was an exercise physiology major, what we were taught, and this is a long time ago now, but what we were taught was that muscle tissue breaks down and then you get stronger by rebuilding that muscle tissue. And that's been kind of debunked now. It's not necessary to totally break down the tissue. And we don't break down the tissue with BFR because you're using such light load. And so it's one of those things, and I can prove that because we have studies where the studies are actually training with BFR, same body part, twice a day. And if I do that with heavy weight training, what happens? My force production goes down when my muscles are still recovering from prior exercise due to the breakdown of the tissue, mostly. We know that you're not breaking down muscle tissue. That's been studied. And if we're not breaking down the muscle tissue and we're still getting adaptations, that means there's multiple mechanisms for how we adapt. And one of those mechanisms is this metabolic response. And that's really what we're tapping into, less than the mechanical response, which is what we would do with heavier weights. You get faster fatigue with less volume of exercise, perfect for older adults, frail individuals, joint-limited patients, deconditioned populations, and your rehab patients. And I will even add, I'll have a future session on BFR for bone growth, like osteoporosis, osteopenia, and fractures. But I can use this in people, not so much with exercise, but passively to build bone. I'll even use this on people that have a cast on or a brace. I'll use it for people pre-surgical, immediately post-surgical, when there was no way that you could have them do exercise typically and preserve muscle mass when you normally would get an atrophy effect. So we look and see, like, has there been a bunch of studies at all on BFR and sarcopenia? Zhang did a study in 2022, and they looked at low load resistance exercise and low intensity aerobic exercise. And what they found, their group found that they demonstrated improvements in muscle strength, muscle mass, and functional performance. So if you're interested in this study, just the full text, just text me or email me, and I will be happy to provide it for you. So you can look at all the parameters and all that stuff. But basically the typical parameter that we do, the 75 reps per exercise, and 2 to 3 times per week is as effective as 5. So I typically will prescribe, usually it's 2 days for each body part. And I've had previous sessions on differentiating between hypertrophy and strength. So you can go back and look at some of those. Most of the difference between hypertrophy and strength with BFR, I'm using heavier loads for strength training and lighter loads, but more pressure on the cuffs with hypertrophy training. I'm also going to use multi-joint or compound exercises, something like a squat or lat pull down for my strength training. And for hypertrophy training, I'm going to use more simple exercises or single joint exercises like a bicep curl or a tricep extension. People will ask, is BFR safe for older adults? And I'll say yes. The key safety principles is you want to do a proper screening, individualize the pressure. You want to use proper cuffs that are wide. You want to use cuffs that measure the limb occlusion pressure. And so you're using a specific pressure and you're not guessing on these things. And then doing appropriate exercise selection, not, monitoring during sessions, at least, self-monitoring and not pushing themselves too hard. One of the keys with older adults I have found is making sure that they eat before training with BFR, because it will make you a little lightheaded if you're doing any type of compound exercise. So I love sit to stand. So they just sit in a chair and they go to standing, and they'll do that repetitively with the BFR cuffs. No weight, just doing sit to stands. If you do that on an empty stomach and you get 75 reps, you're going to feel a little faint. even in the healthiest of people. So a little food before BFR goes a long way. I wouldn't exercise on an empty stomach. Some common BFR myths: it cuts off the circulation. This isn't true. Its arterial flow is maintained. Venous return is blocked, but it's typically only going to be for about 6 minutes. It's going to be for the session of exercise, and then what we do is deflate. This is considered continuous BFR, meaning that the cuffs are inflated, they're causing compression, and during the exercise and the rest period, the cuffs stay inflated, and then you deflate between exercises for 1 minute. That's continuous BFR. We also have something called intermittent BFR. Sometimes I'll use this technique with older patients. And what this is that you only inflate during the rest period. So you do regular exercise without the cuffs, and then you put the cuffs on, and you basically trap the metabolites. That increase in acidity in the tissue creates local change at the muscle and works very well. It's just, I don't do it often because it's a little cumbersome. Exercising without the cuff and then putting the cuff on, a little time restrictive. And the other thing, people think it's only for athletes, but actually it's one of the best tools for clinical populations. I use it for athletes. I use it for pre-practice, post-practice, pre and post-event. I use it for between events, like for basketball players that have multiple games a week. I'll use it between games. It doesn't break down tissue, so it doesn't reduce muscular force production. So by the time the new game rolls around, if we do this after a game, they're back to 100% force production. We'll use it to prepare for a heavy lifting day or a heavy plyometric day, which would normally cause a lot of strain or stress and cause muscle damage and then soreness and delayed onset muscular soreness. That's a protocol we call ischemic preconditioning. So preconditioning or pre-exercise, preserving the muscle and not causing as much damage to the tissue. So lots of ways that we can use BFR, both in the healthy populations, the athletic populations, elderly, rehab. Almost everybody can incorporate BFR, whether it's in their fitness or it's in their rehab protocols. Who I think may benefit the most, I don't want you to think that I'm a homer, that I only do BFR, because it's not true. I actually train most of my patients in my office on something called an adaptive resistance exercise, which is a computerized resistance. And that's because I can basically take them to failure, pretty close to failure, repetitively, safely. And that's why I use the ARX. But people that can't do the ARX, they can't do that heavy load training, then I use BFR instead because it's a nice substitute. Or a lot of my rehab patients, rehabbing somebody right now with tendon bicipital rupture repair, we do BFR on the repair side, but then we do heavy weightlifting on all the rest of the body. So we're not having to limit except for the rehab side, so no reason to. Who needs extra screening? How do we be safe? Be careful screening for people with vascular disease. We talked about uncontrolled hypertension, active clotting disorders, and severe cardiovascular conditions. So safety always comes first. So you want to make sure that you're clear before participating. Typically, if you're cleared for high intensity exercise or high intensity interval training, you're cleared for BFR because your heart rate will go up, but it won't go up as much as it would with those. Why training still needs structure? BFR is not just put a cuff on and exercise. We do have effective and safe requirements and recommendations, meaning you're using the correct pressure, you're doing the correct exercises, you're doing the correct volume, correct progressions, and those things matter for getting good outcomes. We have a couple different products I'm sure most people are familiar with. We have a Generation 3, which is the one that I still recommend for older adults. It's what my parents use. That's the non-app based. That's the one on the bottom of this slide. Basically, the pump and Doppler, which measures the pressure, essentially gets plugged into the cuff, and then you unplug the cuff. It's a little bit more user-friendly for those that are not technologically, or I should say have a tough time technologically. And then we have the Gen 4, which is our newest cuff that is app-based. So the cuffs are basically listening to the app and you set everything in the app. So in some of the future discussions and modules, but also you can get a lot of free education on smarttoolsplus.com. You can go on my YouTube channel. You can go in our private school group where I have about an hour free class. And we talk about how to select individualized pressure levels, how to determine limb occlusion pressure in different positions, exercise selection and programming strategies, weekly progressions and adaptation over time. And then I give some case-based examples and real-world applications. So some key takeaways tonight. What I want you to take away is sarcopenia is common but treatable. Heavy lifting isn't always possible. BFR offers a safe and low load alternative. And again, it's an alternative. It's not the end all be all. If you can lift heavy load, I would recommend lifting heavy load as much as possible. When you need an alternative, this is there. Proper education is essential, and BFR can help older adults stay strong, mobile, and independent. So what's coming up next? Next month, we're going to talk about safe screening, setup, and pressure selection. We have some other case studies and demos coming up. Actually, next month, BFR for chronic pain and joint preservation will be our topic. If you've registered for this class, then you've registered for all the classes. I do have an ongoing BFR Bootcamp. And so if you need help, you bought the cuffs and you're like, now what? This is kind of a deep dive. I say it takes 4 weeks because there's a lot of content, but you can do it as fast as you want to do it. And it's basically, I take you through how to use the app, how to utilize the cuffs safely, how to write your own programming, really intended for a person that's not working with other individuals, but everybody would get something out of it. Oh, included in that is me coming on once a week to answer any questions. So I try to stay engaged and answer questions close to live as possible. And then for professionals, if you're a strength and conditioning specialist, an athletic trainer, chiropractor, physical therapist, anybody that works with individuals, you can use our BFR level 1, even get continuing education. BFR level 2, BFR level 1 is really like starting the foundation and does rehab principles. And then BFR level 2 is clinical and performance application. So pre-post exercise, things like that, recovery. And we also have an instrument assisted soft tissue manipulation course in there that's all online. And you can scan this to get to that course. Of course, if you don't have the BFR cuffs, by attending this webinar, you can get 10% off by using the discount code education10 if you go to purchase. Here is my Instagram and my YouTube. If you want to follow along on what I'm doing, I'm trying to post more, just I'm really busy seeing patients all day. So otherwise, if you have any questions, feel free to reach out. That's my office number. You can always text. That's my email on my social handles. All right. Well, if there's no questions, let everybody get back to their night. I really appreciate you joining me on a Thursday. I will see you next month. If you have any questions, feel free to reach out. Otherwise, be well and God bless. Bye for now.